Alright, team. We have a somewhat unusual case today. Our patient has been rescued from a house fire and seems to be having inflammation, esophagitis. Any ideas?
This could have all been caused by smoke inhalation from the house fire.
I agree with Frank.
I also agree with Frank.
As much as I want to join the Frank bandwagon, I'm going to disagree and say it's fake.
That's it. There's got to be more than just a simple house fire. How does a patient contract all of that?
It hasn't been said how long he had been in the house for.
All we know is that he came out of the house safely, then collapsed and called 911.
Why are you saying it that way? It's 911.
Patient's words.
Seems that he did the right thing anyway. If he waited any longer, we'd be talking to a piece of toast today, and not the good tasting kind.
I'm not satisfied on a diagnosis at this time. Looks like I will actually have to talk to the patient today. You wanted to see me, Tracy?
Yes, Hawks. Normally you're here to tell me why you're about to perform an unnecessarily risky surgery on an unrelated diagnosis.
Why isn't that happening?
Because I'm being distracted and called to your office for some stupid question about the status quo when I could be spending it with the patient.
Why do you suddenly care about the patient?
How dare you? I always have my patient's health in my best interests, even if I get the diagnosis wrong. I simply have no diagnosis to go off of yet because the symptoms and circumstances in this patient's health don't ring any obvious bells.
Hawks, that's not like you.
This patient's not like other patients. Normally you get out of a house fire, breathe fresh air, and after a bit of time, you're fine. He isn't fine.
All right, I see your point. I'm sorry for wasting your time.
Thank you.
Hawks, what are you doing here?
I was about to ask the same thing. I told you I was going to talk to the patient.
Well, you're too late for that now.
Oh God. How? We could lose him so quick. I didn't even demand a risky surgery yet.
He's not dead. He just went back to his friend's house after we talked to him for a bit.
Okay, I guess it's not important then. Back to work, everybody.
We don't have any other patients to look after today.
Then go hold a bucket of sand or something to justify getting paid.
He means there are literally no other patients in this entire hospital. Everybody's fine.
That doesn't make any sense. No, that cannot be.
When's the last time we had even a serious case to look after?
Yesterday, for Christ's sake, and the day before that. How do we suddenly have no patients? Team, I don't know how else to say it because this has never happened before, but the hospital is completely vacant, apart from staff.
Sweet. There's a new movie I wanted to go watch at the adult movie theater today. Anyone want to join me?
I'm going to stay here until the day is actually done. There's no way we will stay empty for long.
Good idea.
That's fine with me.
I'm not fine with it. If I wasn't low energy today, I'd unleash some of the lab cultures into the city water supply so we could justify being here.
Just go to lunch, Hawks. You're hungry, and when you won't be, I'm sure you'll be in the mood to do that.
Whatever. While I'm gone, pretend to be useful and go wash my car. If any of you catch Gary trying to leave and watch that adult film, don't chase him. He won't be welcome back.
Will do, Hawks. That is a pretty disgusting thing for him to brag about in the workplace.
That's not what he's worried about. Hawks saw the same movie last night.
How did you know?
He texted me randomly at 1 in the morning, rambling about how it left him with less brain cells than the time he lost oxygen for 2 minutes.
Shit. That was the damn pills. I'm actually sorry about that, Randall, for any discomfort that caused.
I got over it. My girlfriend was laughing her ass off when I tried impersonating your voice while reading the messages aloud.
Jesus, it's like you're going cutthroat for Gary's status as the most obnoxious doctor. I'm out of here. Johnson, funny seeing you here.
I always eat lunch.
I know, I was being sarcastic. Anyway, how are you handling the sudden lack of patients in the hospital? I imagine you have an experience like that on a daily basis with your clients.
That's pretty low, Hawks. But yes, it's like that, but on a far larger scale because my calendar is just empty. I don't know what's going on.
I don't either, and this is making me as uncomfortable as the incident we had with the alien body.
What makes you say that?
Don't tell anybody else about this, but that patient I had this morning was just off. It felt like he had come from some other universe.
Was this the house fire survivor?
Yeah, he told me this bizarre story unprompted about how he actually faked needing to go to the hospital because his friend was the one who started the fire.
That seems rather rude.
That's not what I'm focusing on. The fire happened at the patient's house. They have lunch every single day, like you and I do, except it's usually at the friend's house. And on a daily basis, without fail, the friend accidentally sets the house on fire while cooking. Only the patient is aware that every dinner is like Groundhog Day. Today, the patient was cooking with the intent of breaking some cycle, only he went to the bathroom briefly just to find that his burnt roast turned into a steamed muffin.
And I guess in frustration, he came here as some plea for help.
Exactly. I have no idea how I'd remain sane if that was happening to me. And the reason I had more questions for him was,
Hawks, Johnson, I need to see you in my office.
not now, Tracy. I'm just about to find how many licks it takes to get to the center of a Tootsie Pop.
You are not in trouble, but this is urgent.
All right, what is it?
As you're both well aware, we have no patients.
I hardly have any either if you're just going to be around the bush.
Shut up, you know what I'm referring to. The reason we lost the patients is because we no longer have a hospital.
How did that happen?
Apparently, word leaked out of some extraterrestrial hiding in storage. The government caught wind of it and have effectively locked us down until they find it. One of you has to know about this body. The only reason I have Johnson in here is because I know he won't lie to me.
What does this matter? If they claim it's in storage, it shouldn't take them more than a few minutes since we hardly store any protective gear in there anyway.
Stop playing stupid. What are they talking about?
I don't know much about what's going on because while I remember Hawks telling me about his doctors playing a prank regarding an alien, that was the only thing he told me.
Fine. I covered it up because I wanted to prevent something exactly like this. The one person who placed it secretly in storage and would remember it is the late Dr. Kelly.
You said it yourself. Storage isn't that big, and it shouldn't take more than a few minutes. However, there's a problem with that. The government has known about this and has been investigating storage in secret for 2 weeks now. What began as an audit on the pharmacy inventory,
Which I had nothing to do with, for the record.
They looked in storage and found the silhouette of an unusual body shape on a stretcher in storage. The body's nowhere to be found. From what I've gathered just from glimpsing at the spot, their outline is surrounded by a perfect circle, as if something above sucked it out of the hospital.
Guess that would explain why there were repairs on the roof in that area.
Oh God. That was July 20th. That's the same night some earthquake and strange lights were reported near the hospital.
I forgot that was on the news. Seemed like the lead went dead quiet hours later.
Not only that, Dr. Kelly's heart transplant surgery was that day, so it really wasn't Frank or Gary at fault.
The ground shook, the lights briefly went out, and in the process the bypass unit malfunctioned. Shit! I owe them an apology.
There's someone else you need to apologize to as well, Hawks.
Sorry, Dr. Johnson, you did help me keep this under wraps, and I presumed on our friendship.
He means me. You lied to me, Hawks, and now I can't trust you on anything. The bad news is that I have no choice but to trust you because effective immediately, we are contracted to work out of the Ridge Street Hospital near the former insane asylum until this whole thing blows over. Once that's done, I'll decide what's next regarding your employment.